I started Tribal Health because I was hired as a chief medical officer up at a 638 hospital outside of Phoenix, about 90 miles away. And I immediately saw the disparities of care between how I practiced medicine in Phoenix versus how medicine was being practiced just 90 miles to the east. And I thought, you know what, this isn't right.
Seeing the care that my people got, it was infuriating and it was sad, and it drove me, and it made it so important for me to make it a priority to show people, to show the world what was happening in Indian country in regards to healthcare.
The quality of care that I saw being delivered was very different than the quality of care being delivered in every place else across the country. And not only that, it was just lack of access to specialists and lack of access to people who were really there to take care of the folks who were really critically ill or had kind of this multi-system sort of disease processes that really required some deep knowledge in a particular specialty.
When John made the offer for me to come on to Tribal Health, I got pretty excited because it's basically Doctors Without Borders with a paycheck. And it really fulfilled what it was that I've always wanted to do as a physician.
So I think the number one disparity is access to specialty services. So we don't have a cardiologist, we don't have a neurologist, we don't have a labor and delivery department where people can come and have their babies and be surrounded by family. We don't have a surgical department, so all of those services have to be referred elsewhere. And that becomes a challenge when people don't have the resources that they need to access that care off the reservation. And then it also burdens them. You know, you have to be away from your family, where family is central, and that's at the core of everything that we do. And now you have to be away from them, kind of in this foreign land, trying to navigate a complex healthcare system, all because you don't have access to that care in your own community.
There is a great deal of alcoholism and methamphetamine abuse. And that's at the core of many of the other problems that we have to deal with. There are plenty of people that are undomiciled up on the reservation. You know, think about that for a minute. It was, negative 13 degrees with a wind chill of negative 37. And there are actually people who will sleep under tarps and in tents, even in that kind of terrible inclement weather. And so one of my transformations, I think personally, is spending so much time in realizing how many people live with so little. I mean, to the point they don't have roofs over their heads. They have no central heat. They sit in front of fires or space heaters. Carbon monoxide poisoning. It's just an eye-opening experience.
For me, from my perspective as a nurse, as a community member, as a tribal member, as a patient who receives care in this healthcare system, I need somebody who's going to come with compassion, that's going to come with heart, that's going to listen and be understanding, and who's going to dedicate themselves to really trying to understand and tackle the healthcare problems that our people face.
If you have a calling and a duty to help fellow human beings and recognize that the playing field is unlevel and do something in some small way to change that, then Tribal Health is just a fantastic job. It's a great opportunity. At the end of the day, you're getting paid to do something that frankly feels like humanitarian work that Doctors Without Borders is doing for free. It's just a really great feeling.
This is a beautiful place to be, and it's a beautiful culture, and you will have an amazing experience if you choose to work with Tribal Health.